With sky-high demand for COVID-19 testing and long delays for test results across the country, some patients report waiting more than 10 days to learn whether they have the virus, or by that point, had the virus. Health authorities worry the delays will undermine contact tracing efforts as infected people spread the disease to people who in turn spread it to others during the lag period. For all of this, I want to bring in Dr. Ron Elfenbein. He's an emergency care physician in Maryland.
Hi.
Dr. Elfenbein, it's good to see you again. Why are spikes in other states causing testing delays in states that have the virus more under control?
Yeah, so that's a really good question. I'm not sure that the spike in, say, Florida really is affecting the ability to get testing in, say, New Jersey or New York or Maryland or Virginia versus just the overall increase in testing and demand in those states in particular. So, for example, in Maryland, the demand for tests has skyrocketed. Yes, I suppose there is to some extent it's true that the demand in testing in states that are really hard hit, like Texas, puts a burden on the supply chain. So that theoretically could make it more difficult to get tests in places like New York, New Jersey, Massachusetts, Maryland, Virginia, et cetera. Just because, these companies that manufacture them and the labs that run them are not necessarily equipped to process hundreds of thousands of tests a day. I mean, they're used to processing, a few thousand a day or whatever. And all of a sudden, the demand has skyrocketed. Now, I suppose they probably could have done a better job of anticipating this, but it's a complicated issue. And there's a lot of people and a lot of steps along the way that have to happen to get the tests where they need to go and to process them in a timely fashion. But I can assure people that—
Sorry, so I'm trying to understand, is this really a workload issue for labs, or is it a matter of equipment and supply shortages that are causing these delays?
All of the above. All of the above. There's a tough time getting people to process the test. That's what I was trying to say. Is that I want to make sure that the viewers understand that we in the medical community, that includes the lab people, the couriers, the doctors, the nurses, everybody. We're doing everything we possibly can to get people tested as quickly as possible. It's just there's an overwhelming amount of tests that need to be done. You can't just snap your fingers and get the test done. It has to be, your person has to get swabbed. The test has to be logged into the system, Ascension, sent to the lab. The lab has to log it into their system. Then they have to put it into the PCR machine. And that takes, 45 minutes to an hour for each test to be run. Now, they can't batch them, but it takes a while to get these tests done. And these labs are, again, not necessarily equipped to run hundreds of thousands of tests at a time. So there's a shortage of PCR machines. There's a shortage of lab techs. There's a shortage of viral transport medium. There's a shortage of swabs. All these things are harder and harder to get because the demand has gone up and there hasn't necessarily been a commensurate uptick in the production side. So it's kind of an all the above thing. Nobody anticipated that we were going to need hundreds and thousands a day of these tests. They should have, and there probably could have been better planning here. But I think that we're kind of now picking up the slack on that.
So if it takes 10 days it does. It also, we're really deep into this pandemic. Yeah. It has taken a long time, and so it seems strange that we're still talking about nobody anticipated this or anticipated needing these levels of tests. But I want to talk about what the implications are. So if it takes 10 days to get a test result, how does that make the job of healthcare professionals, your job, that much more difficult?
Well, it makes it tremendously more difficult. So I just want to be clear that there are private labs out there that can get tests. Like I own an urgent care in Maryland, and we're getting test results in 24 to 48 hours. So there are private labs out there that people can contract with that will get you the tests and will get you the results promptly. It's the big guys, Quest and LabCorp, that are nationwide that are having the most problems. And that's just because getting supplies where they need to go inside of their supply chain is very problematic. And then plus making sure all those tests can be run. They have multiple sites throughout the country where they run tests. And one particular site, they might have to move resources from one site to another. That takes time. As a physician, it's very problematic because the whole idea here is you want to identify people who are positive as quickly as you can so that they know to isolate. At the beginning of this, we told people if you had symptoms, we didn't have enough tests, so just go home and self-isolate for 14 days. And everybody was locked down, so it wasn't a big deal. But now people want to go to the beach. They want to go out. They want to go back to work. So you're asking someone to self-isolate for 10 to 14 days. That's just not happening. So it's kind of like you're trying to fix the Titanic with a cup. you're trying to empty the water out with a cup. It's overwhelming, and the 10 days just makes it impossible. And then it makes it impossible to do contact tracing because those people have been in contact with so many other people in that 10 days. There's really no point in testing them, frankly, because at that point, who knows who got infected.
I just want to clarify one thing. You mentioned that private facilities like your own can turn around test results very quickly and doesn't have these same lengthy delays. But are those also covered and free for people, or do those come at an additional cost? Because there is some confusion about that.
Yeah, absolutely. And I'm glad you brought that up. So the state of Maryland, I can't speak to the United States, the entire country, but in the state of Maryland, the governor issued an executive order, and I believe this falls under the CARES Act, which is a federal act. But at least in Maryland, anyone who presents for COVID testing, it is not free. The insurance company is mandated to pay for it. We, as a facility, are not allowed to charge individuals for those tests. So if anyone out there, certainly in Maryland, is getting charged to get tested as an individual, now your employer can get charged, but not you as the individual. If you are getting charged, you need to report that to the authorities. We just bill the insurance company. That's it. And if the people don't have insurance, we still swab them. The states are helping to pick that up. So, most of that charge actually is really the lab test. It's not even necessarily us. It's the lab processing the swab. But again, by law, they have to be tested if they show up and they want to test, and the insurance has to pay for it.
Got it. All right. One last question for you before we go. The Washington Post reported Saturday that the Trump administration is trying to block billions of dollars for testing and contact tracing in the upcoming coronavirus relief bill. What would happen if the Trump administration is successful in these efforts?
Well, I don't know, because I know they've already allocated over $3 billion to this. So I'm not sure how much more another billion is going to really make a difference. And honestly, I think that a lot of this falls onto the burden of the states to kind of get this under control and do what they can do. And I'll give you an example. You ask about testing, and I can tell you in the state of Maryland, again, we've contracted with a couple of labs that give us 24 to 48-hour turnaround time. We have 5 machines in my office that can run perfectly valid, FDA authorized, EUA approved, CLIA waived, which means that the federal government has said that any lab that exists can run them essentially. But the state of Maryland won't allow us to run them, and they're 15-minute turnaround time. So we can have results to people in 15 minutes, but the state of Maryland will not allow us to run them, not because it's not a valid test or it's not a good test, but because they don't agree with the FDA and all 49 other states that allow this test to exist. So the HHS actually just agreed to give a bunch of these tests to nursing homes throughout the entire country because nursing homes are the hardest hit. So the Health and Human Services Administration has given these tests to nursing homes please go out and test your people so we can isolate those that are sick and those that aren't sick. So, I think a lot of this, again, at least in Maryland, what I know, it's the states kind of getting in the way. I think I'd have to look at the specifics of what you're talking about with the Trump administration. Again, they've already allocated $3 billion. I'm not sure what another billion is going to do necessarily in terms of contact tracing. But obviously, any money is good money. And I think, that would be problematic, I'm sure, if they're going to cut funding to that.
Well, we're going to have to continue to follow up on that point and the local point that you bring up as well. Dr. Ron Elfenbein, thank you.
Thank you.